We look at the epidemiology of pneumonia, and looking at the epidemiology of a disease condition is kind of like you're trying to look at the effect of this disease condition on the world, like how it has affected the world. Okay, you are not trying to look at the details. You're just trying to have a briefing of how many people are affected in a year. Then the big countries like USA, UK, you are trying to see how many people are affected there, so that I can just have a flicker of the idea of the disease condition you are dealing with. Okay, so epidemiology of pneumonia. Pneumonia is what? Disease condition affecting the lungs, all right, causing inflammation in the air sacs, right, causing fluids to now gather in the air sacs, right. So the person will usually be having difficulties in breathing and all that. All right, so it is estimated that pneumonia has an incidence rate of about what, 1.5 to 14 cases of community acquired pneumonia per 1,000 people across the globe. All right, so community acquired pneumonia is like a type of pneumonia you got as a result of what, exposure to this probably like the organisms causing it. It could be bacteria, fungals, and the rest. Okay, so locations, demographics, and seasons all affect the incidence rate of community acquired pneumonia. All right, so this is a world map. Okay, and you could see that countries having the red flag are usually the ones affected the most. Then the ones being on the, how will I put that color, it's kind of like green mixed up with blue. All right, here the USA, the Russia, those ones are least affected. All right, but can you see the countries in red, like all this Africa, from West Africa and the rest. Okay, so from West Africa up to Egypt and all the stuff, right? So those are the countries that are most affected. So you can just pause this and use this key down here so that I can just have a view on how it affects the whole world. Okay, so anything you get here, you multiply it by 100,000. Multiply by 100,000. Anything you get there, all right, multiply by 100,000, then you get the brief of the number. All right, like, how will I put it? Like a range of the number that is affecting each country. So it is estimated that what, pneumonia affected about 5.6 million cases or 5.6 million people in 2011. It is the second leading cause of hospitalization in USA. So it has about 1.1 million admissions in the USA. Okay, so approximately 20% of patients with pneumonia require hospitalization because, bro, they are having difficulties in breathing and all that. So they require what? To be close to the healthcare giver so that they can be monitored. Okay, so it's the sixth leading cause of death in the USA as of 2011. So it caused about what, 60,000 deaths. So about 10% of patients with pneumonia in the USA died as of 2011. All right. So variation of rate in the disease, it has a higher rate in winter months. It is more common in men. It is more common in African Americans compared to the Caucasians. It is more common in children and older adults. Okay, so overall rate for people between 18 to 49 years is just 5 per 1,000 people. That's low. That's the people that are between all those adolescent stage and the middle age and all the stuff, right? Therefore, people above 65 years, it has a higher occurrence. All right, so you could see 5 here, but here is about 75. Okay, so I think that's it for the epidemiology of pneumonia, basically trying to have a rough idea of how this disease condition is affecting the whole world. So that's it.